In general, in our community, uh, even when we look at the suicide cases, there are higher successful suicide attempts by men as compared to those by women. To be honest, most men are just useful because they are giving some economic returns to their families and community. The day you are declared you have no money, you become useless. And men who retire and post-retirement, men are more vulnerable to the disease, both physical and mental deterioration than women. My name is Lawrian Mseri. I'm a counseling psychologist. I work in Taita Taveta County, and specifically I work in Taita Taveta University as a lecturer in matters counseling psychology. I also offer mental health services in the university and in the community. I operate in Timamu Training and Counseling Center, where we offer mental health services, general mental health, general counseling services, and I'm also an advocate of men's mental health, a campaign against drug and substance abuse, particularly amongst the youth. On men's mental health, I've been so much interested in what men are suffering from community to workplaces, and also in the religious environment, in the churches, in the mosques, and in the community at large. Yeah, it is true that men are not very easy to come out. It's the way they are wired, the way they are made, I can say. And we're trying to create awareness. We're trying to sensitize men that there's nothing wrong in them coming out. There's nothing wrong in them expressing themselves, particularly on matters that are hurting them. There's nothing wrong in them expressing the hurt, the pain openly. I know it is not easy for them to change overnight because of socialization. Men have been socialized right from childhood that they should suppress their pain, they should suppress expressing what is going on within them. And my experience has been that most men are suffering from particularly major depressive disorder and other mental health conditions, which could be addressed if they were open, if they sought services or help from professionals. And in general, in our community, even when we look at the suicide cases, there are higher successful suicide attempts by men as compared to those by women. It's because, again, men are suppressing whatever is going on in them and they are dying slowly. Wanasema wanakufa kondoo. And the women, by nature, they express themselves, and by so doing, they easily get therapy uh, from even their activities, from their own social interactions. They easily get therapy, they easily release the pressures that could lead somebody to major depressive disorder. And because of the same, in relation to major depressive disorder, men try to treat themselves. Instead of seeking professional help, they try to treat themselves by now using drugs, alcohol, and other drugs of addiction, and they get addicted to such. Religion is very important. We consider it as one of the channels through which people can also get relief psychologically. But just like the other habits, extreme religiosity is a mental health issue, and it can equally be addictive. It can also cause harm in society, where people get too much extremism, and it affects their behavior, it affects the way they interact with other people around themselves. it affects their, sometimes it can affect their own psychosocial functioning. So religion, yes, it's very important. It can help people get psychological relief, but people should be careful not to have extremism. In our society, we've had sometimes people being too religious to an extent that they don't function well in other aspects, to an extent that sometimes they don't have good social interactions, particularly with people who are not deemed to be identifying with their religious practices or be agreeing with them in their beliefs. What drove me to being interested in men? Yes, I found, of course, being a man, yes, I interact closely with men, and as a psychologist, I've found that men are really suffering right from the youth. In the university, for example, I've dealt with both male and female youth. I find the male youth are dropping out of school probably at a higher rate than the female youth. In society, I've found data that shows that men are, for example, dying from suicide more than the female counterparts. I've found in our villages and in our sometimes even our urban centers, men are easily abandoned and live alone, and this causes a lot of psychological, negative psychological impact on them. Yet, when you go to hospitals and counseling centers and look at data of those who seek psychosocial support, men are very few. Yeah. You look at women who retire and their post-retirement, and men who retire and post-retirement, men are more vulnerable to the disease, both physical and mental deterioration than women. So it's an area that is creating interest in me, that we need to talk to men on post or preparation for retirement and how to go about it. If they need financial advice, I link up with the people experts in financial areas, but psychological, because most of it is psychological. Men, by the time they are retiring, most of them are beaten psychologically because of the challenges in society and the way they are perceived. And you see, to be honest, most men are just useful because they are giving some economic returns to their families and community. The day you are declared you have no money, you become useless. And if that sinks into your mind, it can really kill you. Some people don't believe that counseling should be paid for, and this is particularly those who have not had professional counseling. They're used to, let's say in the afternoon, they're told by their pastor, join for counseling, and they think that's counseling. And it's offered free, for example. Yet that could, to me, amount to guidance. It's not counseling. That is guidance. Anybody can offer guidance. Parents can offer guidance, religious leaders give guidance, any person of authority of others can give guidance. But counseling is a very therapeutic relationship between a counselor and a counselee, which is very technical and has some a unique relationship for the purpose of healing. And at that time of the relationship, counseling relationship, the expectations and the counselor professionally and technically moves with the client, and we expect some healing process to occur. So it cannot be done by any other person. Therefore, it has some financial implication, yes, ranging from 1,000 per session to even 3,000 per session per individual. Group sessions ranging from 2,000 to even 5,000, depending on the client, the place, and the negotiated terms and circumstances that probably guide the availability of the funds. One, the aim of counselor majorly is to help. But again, it's a professional service, just like legal services, just like medical services, and it has to be paid for.